continue on with Steve, yeah? How do you see the infrastructure? If we go into digitalization of healthcare, beginning next year, as Dr. Andre said, how do you see the infrastructure? Is the infrastructure ready for this type of endeavor?
Okay. So I think it's been mentioned before, but that the penetration of internet and smartphones are increasing in Indonesia, which means that actually if we want to push the healthcare apps or the system that been proposed into the healthcare into the system or into the internet or into the smartphone is already there. The questions would be on the awareness of the usage of that usage of the healthcare apps itself. In terms of the infrastructure, we've seen some independent move by certain healthcare players in the market. So we've seen several hospitals in Indonesia implementing a certain CRM system, for example. We've seen the rise of e-commerce within the healthcare system, for example. But they are all independent within each other. So I think one of the issues that need to be solved now is how we can link all that into one integrated solution for the patients. As I said before, patients are more and more going into the customer-centric mind. So what we've seen from the laureate is that in the future, a patient or a consumer do not have to go outside of his home to attain a certain medical services. They can go inside from the home. So they can do telemedicine, as you mentioned before, doing teleconsultations, drugs that's being delivered directly to their home, a certain medical or clinic can come to his house, taking some blood and then get some result, and then the results can be mailed or faxed directly to the doctors, and doctors can give a diagnosis to the patient itself. But that's also another thing that needs to be considered. And then we talk about infrastructure, it also cannot be escaping from the regulations, whether Indonesians are ready to have this kind of infrastructure without the proper regulation, for example. So these are the three things that I will feel that from infrastructure perspective need to be prepared.
So infrastructure?
Infrastructure, awareness, and regulations.
Regulations,
yeah.
Policy.
Yeah, policy.
So 2017, are we ready?
I think if we see the initiative being made by Nusa Health and also some of the other independent healthcare providers, if we move steady towards this effort, I think 2017 will be a good start for us to be able to perform this integrated healthcare solution for all of Indonesian people.
Okay. But I'll go back to Dr. Andre. Is the roadmap there?
Yeah, I think in terms of roadmap, we have a lot of roadmap. For example, we have a midterm development plan, national midterm development plan, and also long-term plan. But then, sometimes roadmap is very rigid, and we have to be very flexible, since so many surprises will come after we introduce this. So, for example, if we have collected all the information, then we have the database, and the government can see this, and they can use this for more precise allocative resource allocation. Yeah? Because, for example, now it's really hard to establish the infrastructure in the eastern part of Indonesia because of geographical challenges. But then with this, the government don't have to build a massive infrastructure, but some allocative one. Thank you.
And I want to go now to the doctors. Are the doctors ready for the digitalization era of Indonesian healthcare?
Yeah, I think it's interesting questions, and would probably then the situations also differ in each district. But I think all are going in the same directions, that now they also think that technology should be placed in the health sector. And well, this is, I think, very good starting point that this initiative now is started, and we actually keen to prove that this is useful, and we believe this.
Will it be disruptive?
Well, yeah, I think, yeah, because technology is usually seen as a breakthrough in the health sector. I mean, in most of people working in the health sector, especially, of course, if you see Jakarta, then it will be probably differ. But a lot of healthcare in other places is probably still lack of the use of the technology, which is, I think, it can be seen as a breakthrough. And in most of cases, a lot of people, we actually observe that health people usually really, how to say, would like to be part of the innovators in terms of the using of the technology.
Are there any challenges in the ED, the Association of Doctors, or the Institute, what do you call it, Association of Doctors profession?
Well,
Will they accept it? This new digitalization era of healthcare?
I'm not representing ED, but
I mean,
well,
as a member, yeah.
I think digital healthcare is something which is will be part of the daily activities in the next future. It's started already, and I think it's something which is actually part of the routine business, which is it's a good added value, I think. Yeah.
So it will be accepted by the profession of doctors.
Of course, it's probably will be then the question is related to the regulations, etc. But I think, all will go to the same directions that they will also think that it should be on place.
So very interesting enough, I go back to the audience that the era of digital technology in healthcare is accepted by the various supply side perspective, the hospitals, the doctors, the technology providers, and the policymakers. And now I open the floor to the audience. And maybe some of you in the audience have tried this type of technology of digital healthcare. I see Ms. Anin here. She is the Miss Indonesia 2015, right? 2015. So why don't you stand up? I noticed that you are on Nusa Health, right? Yeah. Okay, well, give me your comments on what Nusa Health is all about.
Yeah, in this era, hello everyone, I'm Anindya Putri. Thank you, Pajur, for introducing me. So, Nusa Health is a new innovation for healthier Indonesia. I believe that this app will bring Indonesia health better in the future because in this era, technology can be the solution for all the problems in the world. We can like SIXCAP with UGM partnership with for BioPay, Nusa Health apps that we expect can bring Indonesia health become better in the future. In this app, it's available in Android, and then we can check the apps, our heart rate, and then it can remind us about the condition of our health, like we should do exercise, and then we should lose weight, we should lose calories, like that. So this app can help us to remind us to have healthy lifestyle.
I don't think you need to lose weight though, right?
She's been on Nusa Health.
I need to keep it up healthy.
Yeah. So for your generation, the younger generation now, how do you see these type of products like digital preventive healthcare and through digitalization? Products such as Nusa Health. How do you see the acceptance?
Yeah, this app is really user-friendly, especially for youth. And we need to educate the people, especially Indonesian people, how to use and then how to be a friend of this app. Because once we try this app, it can help a lot for us, remind us about to take care of our health. So I think that we can spread to all Indonesian youth and all of Indonesian people.
Thank you, Ms. Anin. Thank you. So I'll open to discussion here. We already have hands up, and please, sir, One round of dialogues. One. Anybody else who would like to comment? Name and background and make your comments or question. Yeah.
Hi, my name is Ari from TV8. I have a very basic question. I'm trying to download this on your on Google Play. Where do I search? Is it Nusa Health or BioPay? And could you tell me more about how many members have been downloaded? What are the bottlenecks? And then what are your medium-term plans? Thank you very much.
The application is Nusa Health, one word. It should be available in the Indonesian Google Play Store. So depending on where your phone is registered, it may not have access to the Indonesian store, but we can sort that out. As of this morning, we have about a little over north of 100 users or registered users. Our goal is to roll this out for the entire country, so it's pretty ambitious. But we've got a series of marketing campaigns lined up starting next week. Our near-term goal is to enroll 5,000 before the end of the year, and then keep rolling from there. We'll target different segments with different marketing messages, but I'll leave that to the marketing experts to sort out. Does that answer the question?
Yes, sir. Please.
I'm not sure if you've seen the movie Big Hero 6, but there was a robot there called Baymax. What is your opinion on robots in healthcare to the general public?
Robots in healthcare. Why don't I allow Sheen to Ms. Sheen Gunn, the CEO of BioPay, to give a comment.
Thank you for the question. Very interesting. I think because we're in this day and age where robotics, automation is so prevalent everywhere. So a big part of robotics is in big data analytics. So I think that is where we need to work together with the healthcare industry to ensure that whatever intelligence that we gain working together with the healthcare data can help to bring more value to patients and consumers. So I think the main challenge with healthcare today, as was echoed throughout the panel and with the audience, is really getting a holistic set of data, getting everybody to understand what exactly your genomic profile or your behavioral traits, your lifestyle traits, because that is exactly, that is your composition of your health. And to be able to piece that puzzle and have that complete profile of yourself, we need, robotics to help make sense of all the amount of data that we have. So I think definitely robotics, big data analytics will have a big role to play in terms of how we work together with healthcare industry players to ensure that we can have more precision medicine, more predictive analytics applied to entire population, such that I think it's not about doctors losing their job. That's not the idea. The idea is that more people will see doctors as professionals who can help them to be healthier, to live a better life at a much more affordable rate. I think one interesting statistics that's held throughout the world is that the top 5% of healthcare spenders accounts for more than 50% of total healthcare expenditure. So if we can tackle this top 5% of healthcare spenders, like identify who are these people, we can help them identify way before they reach the brink of their major illnesses. I think that's what computing, that's what big data analytics can help us do. And that in itself will save more than half the healthcare problem already. Thank you.